And now they know they're hurting, they're in stage 3, they're stage 4, and you're gonna tell them you have to stop everything and do nothing?
Hey, what's up guys? Welcome back to the Stay Sore podcast. My name is Bo Skitsko. As always, I'm your host, and today I have the huge pleasure to talk to Ed Ash. You are a physical therapist, and we are in your facility where you treat people, train people, recover people, right?
Yes, sir.
So I was thinking how to introduce yourself. There's so many different letters after your name. I didn't even bother remembering all of them, but you have a degree in physical therapy as well as in psychology?
I do. My bachelor's degree is in psychology.
Mm-hmm. I read on your website you worked in New Jersey, obviously Ohio, Alaska and stuff. So you have quite a bit of experience here and there. And I think you work with clients as a physical therapist. So
yes.
Psychology is built into the whole thing altogether.
No doubt about it. Because, injury affects your behavior. Yeah. And I mean, we could have a whole podcast on that. Yeah. Really. Yeah.
The topic today, what I wanted to talk to you about is when you get hurt, let's say you go skiing and you tweak your knee, or in the gym you lift something and then you pull something in your shoulder or elbow. How do you know if you can walk it off, or if you need some physical therapy, or just adjust your form of the exercise, or where you need to see a doctor, a physical or a surgeon, or something bad, professional imaging? How do you differentiate? Is it the bad injury, or just walk it off?
It's a big question. I think. So the first thing that I would probably think about is the difference between having pain and having an injury, right? I would say almost everybody on the roster has pain in some way. It's like working with a dancer, right? Those kinds of things. Mm-hmm. They all have pain, but do they have an injury? Type of problem, you want to categorize that because it could be a traumatic thing, like something literally happened, like you tweaked your knee with skiing, or you were doing an exercise and you're going for another rep. Mm-hmm. We hear that a lot. You've heard that a lot. I've done that personally to myself. You probably have too. Yeah. Squeezing out an extra rep, you have an injury. But then you have the kind of problems that are more like overuse over time. Can we talk about overuse injuries first?
Yeah, go ahead.
Because that's pretty common. You could take a stress fracture. A stress fracture is an overuse injury, a common overuse injury. And I have a saying, I say you can only get a stress fracture one way. You earn it. DOMS, like delayed onset muscle soreness, okay? We hear about DOMS. And that's, sometimes you're like, hey, that's a good thing. I'm sore, I had a good workout. But, and then that could add up, and you get excited about that, and then you do too much, and now you're too sore. There's a pathway to overuse, and it's really decision-making, right? And you could categorize overuse injuries in 4 categories. Stage 1, we talk with athletes a lot about this, so they understand how to make these decisions, because stage 1 would be, they do their practice, they do their workout, everything's great. There's not a problem at all. They take their drive home, they get out of the car, and they notice their knee is sore. They feels like it's a little bit sore. And they don't even think about anything. It goes away, and you don't even think about it. We call that stage 1. Level 2 would be they're warming up, and they notice their knee is sore a little bit. Maybe it's a little bit of soreness, but it goes away after the warm-up, and they play, no problem. And then again, they take the ride home, they get out of the car, and it's a little bit sore again. So a little bit at the beginning, in the warm-up, goes away totally, and a little bit later on after the activity's over.
I would assume that's very common, right?
Very common. Stage 2, very common, right? Because stage 3 is just like stage 2, but it doesn't go away during the workout or during the activity. You kind of feel it throughout the activity. Okay. But it's not, here's the key, it's not interfering with the performance, right? So it's like you can do everything that you need to do. Nobody is going to ask you, is something wrong? And you feel like, hey, I was able to get through my whole workout without a problem. I felt it a little bit, but it must be okay because it didn't interfere with my ability to do what I need to do.
That sounds like my life.
That is, right? A lot of people live there. A lot of people live in, that's stage 3. Stage 4 is just like stage 3, but the difference is the intensity. And really the criteria in stage 4 is that now your coach says, what's wrong? I could see you're holding up. You're not trusting this. It's clearly, now you're not lifting as much weight. You have to stop in the middle of your set of push-ups. It's like, it's hurting. That's stage 4. Okay. For us, when we're talking to a patient like this, because we see overuse injuries a lot in here, and then you see overuse injuries in categories of people. You see the other types of injuries in these big collision sports, that kind of stuff. And obviously you kind of know a big injury when you hear the story. They have a great story. The others are real insidious. They creep up. And then you're like, I'm not sure how this started, right? We hear that story all the time. Yeah. So stage 1 and stage 2, we could live there. Like you could live in stage 1 and stage 2.
I hate to say it, but it's almost part of trying to become better.
It is a little bit. It is because, like runners, for instance, right? Runners are always worried about overtraining. And I say to every runner I treat, you're overtraining anyway. Just accept it. Because running high mileage is just, it's not really like a natural thing. I'm not saying it's wrong. It's not wrong.
It's very repetitive.
But if you have that, it is. It's repetitive. It's just over and over again. And as the way a lot of sports are, dance, gymnastics, these kinds of things. And to a degree, a lot of the, so you're always you accept the fact that you're overtraining a little bit because that mindset helps you then to make better decisions so that then you can do your cross-training a little bit more, right? If you're in stage 1 and stage 2 and you understand all the stages and you understand what your management strategy is, meaning like, okay, I got to do some correctives. Like we could talk about correctives too, right? But I've got a couple things. I went to the physical therapist or I saw this online or whatever, and I'm going to do a couple of these things for my knee or for my ankle. I'm going to do a little ice massage at the end or whatever it is. As long as you're doing that, then you can live in stage 1 and stage 2. If you're in stage 3 or certainly stage 4, then you must rest. Now, what does rest mean, right? So does rest mean 100% shutting down?
To most people it does.
Right.
That's a good excuse.
Who's interviewing who here now, right? Okay, but no, but sometimes you do have to shut it down entirely, right? It's pretty bad then.
It's more than systemic, nervous system and stuff.
Yeah, and it's active rest because we want to kind of get rid of the inciting activity. Say we're going to step back from that, but there's lots of other things we can do. If it's downstairs, we can go focus on upstairs. In opposites, we can do cardio, we can do all this stuff.
Yep.
So we're going to keep the blood flowing, we're going to keep
Because
moving.
blood flow repairs tissue much faster.
No doubt.
So the worst thing you can do when you have an injury in one little part of your body, the worst thing you can do is sit down and do nothing because then that part is not having more oxygen and nutrition coming in there, right?
You're exactly right. You're exactly right. And the other thing too is like from a client's perspective, from a patient's perspective, and we see a lot of young people, but anybody, like we go back to the psychology thing, and now they know they're hurting, they're in stage 3, they're stage 4, and you're going to tell them you have to stop everything and do nothing, and we know that pain triggers a response in our body, right? Pain is like our body doesn't appreciate that. Our body's always going to try to move away from that.
Pain is a good thing if you think about it.
You're exactly right, right? So we just have to acknowledge it. We have to treat it. So I think having this conversation, understanding that there's a plan, that there's a management strategy. We do that at kind of maybe like a more elegant level or a robust level because we've got with these big injuries in here, right? Because we've got that's our training.
Yeah, that's what
but
you do
you
for a
can
living.
make these decisions like at the street level, right? I mean, there's no doubt about that, and just understanding that. But so many people push through 3 and 4. They're pushing. And they just have to understand, like, okay, well, I need a couple correctives. But having that mindset where, okay, I can do active rest, I have a support system, I have a plan, like from a behavioral standpoint, like from an emotional standpoint, which I feel like has a lot to do with how your body heals.
I agree with you
right?
100%.
And I think that gives them, power over the problem rather than the problem having power over them. I feel like that's a big deal about what we do here. Teaching people how to solve their problems.
A lot of time people think I teach people how to perform an exercise like mechanics and then push them. That's supposed to be my job. And then your job's probably like the same thing but a little more elegant, where you teach them how to do corrective exercises and then do some therapy and mobility and stuff. But I think a lot of our job, if not the most part, is talking people through what's going on instead of doing the physical part, explaining to them how to react to it and how to what attitude to have towards the exercise or towards the healing process. Big part of our job, I would say.
I mean, I spend probably 80 to 90% of my day teaching.
There you go.
Really teaching and having conversations about this stuff and problem solving.
Yeah. So we talked about the overuse spectrum of hurting, pain, injury. So what if you actually get hurt, something clicks, something like, can I walk it off? When do I have to see a specialist? When do I have to do imaging? And when should I get worried, scared?
Yeah, that's a good question. So the overuse category, really you're only having the pain during, like when you get to 3 and 4, right? It's during the activity. Even in maybe a stage 4, you could have a situation where if you are then away from the activity the next day, the day after that, like you can walk around, you're not having the pain, right? If something happens, you tweak your knee, you squeeze out the last rep, pull up, whatever it might be, you tweak your shoulder, your elbow, and now every movement hurts, every step hurts, or even worse, maybe something is like stuck or locked or feels, doesn't feel right. We talked about pain being a good thing. When it doesn't feel right, that's always a good time.
When it doesn't feel right after the activity in everyday life?
I'm saying we're talking about now an injury, right?
Yes.
An injury, like the injury. So, trust your gut, I think for sure too. But again, if it's something where every rep or every step after the workout, now that to me is an injury, right? Now we've got to probably go see, this is what we do then, right? So you could go see your family physician if you wanted to. You could go see, if you have like an orthopedist or a sports medicine specialist, a physician that you wanted to see. This is what we do, physical therapy. And just so people know, in Ohio, many other states as well, almost all the states, you can come see a physical therapist direct access. You don't need to have a referral. You can simply make a phone call and you can schedule an appointment. And part of our training is to really understand what's going on and then to know, hey, is this something that we can take care of here and teach you how to manage it? Or is it something that's going to require imaging or further consultation?
Now let me ask you this real quick. Are you allowed to diagnose as a physical therapist?
So the short answer is we don't medically diagnose, but we know a tendonitis.
Well, I understand.
You know what I'm saying?
Yeah.
So we are trained in differential diagnosis, meaning like if you have knee pain and we do an examination, our job is to determine is this a ligament problem, a stability problem? Is this a meniscus problem? Is this a tendon problem? So we understand that level of working diagnosis so that we then can put a plan together, or we can make a determination if this case needs outside consultation. And I've been working in the business for 25 years. I have a great network of really, really good surgeons that I know in different areas. If somebody needs to know, hey, who's the best, who's a couple good back surgeons to see, who's a couple good pediatric orthopedists to see, getting to the right guy or gal with the right training at that level to have that discussion about, hey, after the MRI, and to understand, is this a surgical problem? Because then you're getting into, you want to be able to talk to somebody and get a couple consultations. And we work with surgical cases all the time, right? And we make these consultations. So we've been working with a lot of these people. That could be very helpful.
Back to my original question. When should me or like the average Mrs. Jones, mom of two, was working out, tweaked something, when should she start getting worried and call a doctor?
I think coming to physical therapy, and a lot of people going back to that concept that something bad has to happen. And I think maybe this is also something just to talk about, is that it doesn't really have to be that bad. You don't have to have this big injury to come see the physical therapist, because what we do really well is maybe help to troubleshoot this stubborn, kind of low-level, frustrating, familiar problem that is insidious and kind of hidden, maybe not talking about it too much, that a lot of people have. Back pain, pain in the butt, pain in the leg, so pain in the shoulders. So these little things can be very, very helpful to come in. Personally, I would go see the physical therapist first. I think if you're like if you're in the Medicare category, I think we recommend that those folks go see the family physician first and let them know, then to get the referral to come to physical therapy. But I think seeing a physical therapist first, when that's happening, and then working with somebody like you. And, we talk to coaches all the time. We talk to, like sports college coaches, high school coaches, club coaches, putting these plans together, talking with personal trainers, talking with yoga instructors.
You guys trained a bunch of my clients too.
Yeah.
So the overuse element of it, you can kind of gauge yourself and make decisions by yourself if you like go to the gym by yourself or something like that, or manage it with your support system, like your workout buddy or your trainer or whatever. But then when you have like an acute injury, something is really like pain, hurting, tweaking, whatever, you put together a plan And you go through the plan, and if the familiar pain is not going away while doing that, or at least improving, you should either change the plan or ask for more professional opinions, which the next step would be maybe physical therapy or potentially your family doctor. That still might refer you to physical therapy, or if the physical therapy is not an option or not helping, then imaging, correct?
Yeah, absolutely.
Am I getting that right?
You are absolutely right, yeah.
Okay. Best way to treat injuries is to prevent them.
But prevention is not sexy.
Yes, and I say that to my clients sometimes too. Before I explain the next exercise, I say, let's learn something new. This is the stuff that is not sexy, but you need it if you want to be able to do the sexy stuff.
Yeah.
Like when people talk to me, how do you lift 500 pounds in the deadlift? Well, because I can also do impressive things on one leg without even shaking. You know what I mean?
I know exactly what you mean.
Those things sometimes, like you said, are not sexy, but very important. And I think the keywords, two keywords in this setting, in this topic that we're talking about, is one that you mentioned, was familiar pain. If you have over and over familiar pain, that shoulder keeps nagging me for the last 2 years, but I'm still like pushing through and still doing my stuff. Or the other word that I think is, or sentence is, preventing injury instead of healing injury. Why would you heal injury if you can prevent it?
I totally agree. And I kind of joke when I said that. It's not a word that I use here, but I think, if I'm most interested in anything, I'm interested in prevention, because we see the same things. I think we think the same way about a lot of things. And when you see an injury, then you always think like, man, how could... Some injuries you cannot prevent, right? I mean, we see these injuries on television. We're watching a game, and you see these massive collisions, and the leg goes this way. Like, that stuff happens. But these injuries where you have... it's a result of bad decision making, or it's simply like an athlete running and they make a little cut, nobody's around, and they tear their ACL or they sprain their ankle. Well, if you you learn that those kind of things, you may not be able to, prevention is an interesting word, but like reducing the risk. Like, we always are interested in reducing the risk as much as we possibly can. And essentially that's what a lot of these therapeutic exercises are, these corrective exercises are. They're really prevention exercises, but a lot of people aren't interested in prevention. We're in a society where everybody wants, they want a number, they want the data, they want to lose the weight, they want to lift the weight, they want to run this fast, they want to jump this high. But really, if you go and you go and look at a group of professional, high-level achieving athletes, and you go see how these athletes train, they work on the absolute base fundamentals every single day, every single workout. Sure, they do the big deadlifts and they do that stuff, but every single workout, they're doing the base layer, foundational stuff, and that's what keeps them on the field.
Most people think of working out and results like in like that Rocky movie with Eye of the Tiger blasting in the background, lift, go hard, Yeah. But the true performance and the true, for lack of better word, bad buttness comes from those little controlled things that will make your big lifts and jumps and sprints that much better and more controlled.
Everybody that you work with has, certainly the injury people that we work with, they have this little group of corrective activities that they have to do. Corrective exercises is become a common term, or recovery exercises or corrective exercises or therapeutic exercises. These are all very similar things. But I think you can avoid this, and these clients of yours can avoid this most often if you get to really know these people.
Yeah, of course.
And so you understand, like, they've got this tricky shoulder, they've got this tricky knee, they've got this history of this back. So each of them is going to have their little package of these little correctives that they do, and that is what's going to help keep them to be able to, so to speak, walk it off. If they're really being proactive instead of reactive, I think that's like the mindset, right? Yeah. We got to be proactive and continue to do those, and you're going to see that happening a lot less. And if you're making all those right decisions, being proactive, doing your correctives, making the right decisions, trusting the movement quality and learning the movement quality, and you still can't walk it off, I mean, then that it's probably time to not stop everything, but just like it takes a team, right? Sometimes to get this stuff done. Yep. So now then we're on the same team. We say, hey, you come see one of us, a physical therapist, and then we teach a couple things, and I say, I'm going to call Bo, and I'm going to talk to Bo and say, hey, here's what we did. This is what I've got so-and-so doing, And these are some of the program that she's on or he's on. And let's see how it goes, right? Let's work this together.
Sometimes it's a matter of trying different things to see which one works best.
Yeah.
Because everyone is different. I think this topic is super important because even if you do everything perfect, once in a while you have a little boo-boo that you need to deal with. And I hope this is going to help our listeners to understand the types of injuries going from overtraining, overdoing certain movement patterns to straight out getting help. Ed, thank you so much for being here. And where can people find you if they have more questions for you?
We're at Active Physical Therapy, so we're in Richfield, Ohio. And
Is there a website?
Oh, there's a website, yes. ActivePT.com. We've been in Richfield, we've been here since 2007. So,
wow.
And now we have a new facility here since 2020.
The facility is beautiful. I'll place some pictures of the facility in the background while we talk. Thank you so much, Ed. I'll link your information down below. Guys, if you have more questions for Ed or for me, leave it in the comments, subscribe. I'll see you next time. Ed, thank you so much. I have a feeling we're going to do this again.
I'd love to, yeah. It's great.
Stay sore, guys.